It's Local Edition. I'm Brad Pomerance inside the state capitol today in Carson City, joined by Mike Sprinkle. He is an assembly member in the Nevada State Assembly, majority whip as well. And you work as a paramedic, and so I'm really glad we're speaking about this topic, and that is the opioid crisis. Quick anecdote, my wife has Crohn's, and she was given tincture of opium to treat, took it for 2 weeks, decided to stop, didn't like it, and then went into withdrawals. And that was our window into the opium crisis.
Absolutely, yeah. This has been going on for several years now. Something that, as working as a firefighter paramedic, I've seen on the streets numerous times. And
tell me what you've seen. Really paint a picture.
Absolutely. So it's really unfortunate when a person gets to a point where they are so dependent on an opioid drug, either the prescription drugs that come when you're injured, when you go to the hospital, or once you're unable to get those anymore, then they turn to the illicit drugs such as heroin. Either way, once I respond on these individuals, the worst case scenarios is it has completely suppressed their ability or desire to breathe, and so they stop breathing. And it obviously is very life-threatening. So very serious situation, and we've been dealing with this increasing problem for several years now. And as a legislator, I've also had the unique opportunity to start looking at it from a legal and from a legislative point of view.
And what's remarkable about this crisis is it's so prevalent that even during the presidential campaign, there was discussion about attacking the opioid crisis. And now the governor of the state of Nevada, Brian Sandoval, has said he wants to make it his priority to attack the opioid crisis. What do you make of the attention being paid to it? I mean, obviously something's going on. You see it.
Well, I think you just answered my question for me. What do I make of it is with that kind of attention nationwide, it truly is an epidemic, and it's been going on for several years now. I think our governor, along with many other national governors, have identified it. We passed legislation 2 years ago where I was very happy and proud to work with the governor on that, and then we're doing even more this coming session.
And let's talk about that legislation, because I think it's worthy of mention. I understand that under the legislation, you increased access to the antidote. What's it called?
Naloxone.
Right, which if it's given to the patient, what happens?
So the scenario that I already gave you, when somebody has stopped breathing, if we can get there in time, and that's the impetus of this whole legislation, if anybody can get there in time and give this medication, it immediately reverses the effects of the opioid.
And we also saw legislation passed in 2015, which provided limited immunity to call in when there's an overdose. Explain that.
And that is truly the most important part of all of this, because what that means is if you find yourself in a situation where you need to give this to your friend, your brother, your sister, whoever you're with, you are not going to be held criminally liable because you're in a situation where maybe illicit drugs were being used, or there was the wrong use of a prescription medication.
Was that hard to get passed? I could see the increased access of the antidote passing fairly easily, but was that second part hard to pass?
No, actually, I think it coupled very well with that legislation, because people were not necessarily going to be willing to give this if they didn't have that kind of protection. The problem is the antidote does not last as long as the actual drug, so there has to be the follow-up. People still have to call 911, and that individual still needs to go to the hospital, or else the antidote will wear off and they'll stop breathing again. So
how, in Nevada, anyone could get the antidote? I mean,
no, not right
explain
now.
But it's increased access. So what is the access?
So the current law allows certain, most first responders now, which didn't exist before, it used to only...
Like you.
Like me, but it could also be police officers, security guards, things of that nature. But it also could, through prescription, be given to family members. Say that you know that your child has an issue, but you're concerned about their safety, you can now get this medication.
That's revolutionary.
It is, and there have been several other states that have looked at it in the last 2 years to do it themselves.
Is Nevada the first?
We were one of the first. I'm not sure if we were the actual first. What I'm proposing to do this legislative session is to actually make it over the counter so that anybody can have access to it. What we will do is there will be a requirement that they have a consult with the physician or the pharmacist that's giving it to them, so that the information about still needing to call 911, still getting the health care professionals there, gets imparted to the person.
My dad's a pharmacist, and I bet he would appreciate that additional responsibility because it's weighty, but it's important, and it saves lives. And I mean, you know this better than I do. Opioid addiction, it's so often not, I mean, it's the suburban mom.
Right,
You know,
absolutely.
it's the dad just doing a 9-to-5 job, hurt his back. You know, the mom picking up the kid, hurt her back, and before they know it, they're hooked.
Yeah, and I know we have limited time. I'll just say that it's a much bigger issue than just the use of naloxone. There's so many other things that we will be looking at this legislative
and
session.
let's talk about that, because the governor says he will introduce the Controlled Substance Abuse Prevention Act that's focused, I believe, on opioids. Is that right?
It is, and it's focused on prescriptions primarily, and how prescriptions are being dealt out, how the kind of education and training that our prescribers, which sometimes you need to explain, that's not just physicians. There are others, there are nurse practitioners, there are dentists that also do prescriptions as well.
Well, I've learned through my father, the amount of both doctor shopping and pharmacy shopping is remarkable.
It is, yeah.
I mean, fortunately now with insurance, if you're trying to get the drug through your insurance company, or at least have them pay, the pharmacist can see that you got it 2 days ago at another pharmacy, you know, with modern technology, but it's still a significant challenge.
And that's the thing, is with modern technology, we're able to gather this data, and we're really able to start looking at both the usage and potential overusage, but also how the prescribing habits of those who are writing those prescriptions.
I want to speak about, and on a broad sense, the Affordable Care Act,
Sure.
also known as Obamacare. And again, I'm talking to an assembly member and a medical professional. And so what we know is, look, you can say a lot of things about the Affordable Care Act, but in the state of Nevada, it looked like it's been pretty successful. You know, there are wrinkles, but pretty successful. We saw about 90,000 sign up for the exchange, about an additional 200,000 sign up for the expansion, almost 650,000 are on Medicaid expansion or otherwise. How are you feeling about the future of the Affordable Care Act and its impact on the state of Nevada?
You know, I can only go by what we all are hearing. There's a lot of rhetoric, there's a lot of rumor. It causes me considerable concern, because I don't know what's coming. If there was a repeal of the Affordable Care Act, if there was simply a defunding of the Affordable Care Act, the financial implications for the state of Nevada, but specifically the benefits that so many people have come to really depend and rely on could be at jeopardy. And that's a real concern to me.
What's so interesting to me about the debate is we remember in 2010 folks rallying against the Affordable Care Act. And now we're in 2017 and we have folks rallying in favor of the Affordable Care Act in very significant and dramatic ways.
Yeah, and you know what I would say to that is, as a legislator, I understand not every bill that we pass is perfect, but if it's got a good intent, then it's incumbent upon us to go back and fix the things that aren't working, not just get rid of it altogether.
I wonder if you, as a leader in the Assembly, can work with the governor, Brian Sandoval, presuming you support the extension of the Affordable Care Act and not the repeal, because look, he accepted the expansion, and it's Republican governors that can get to the new administration and say, whoa, this is going to really hurt us.
I always look forward to working with our governor. I think that that's the way government should work, is that we're all communicating and talking. Might not always see perfectly eye to eye, but we have a very good working relationship with our governor.
His name is Mike Sprinkle. He is the Majority Whip in the Nevada State Assembly. We're inside the state capitol today in Carson City. I'm Brad Pomerance. This is Local Edition.